From NBC News World Headquarters in New York, this is NBC Nightly News with Brian Williams.
As we mentioned tonight, we have news regarding women's health and the situation faced by tens of thousands of women in this country every year, a breast cancer diagnosis. It can be a terrifying and confusing time, and if you've ever dealt with the healthcare system, you know how nice it would be to get a little help. Our report tonight from our chief science correspondent, Robert Bazell.
Francesca Capasso, a professional singer, musician, and actress, learned she had breast cancer right after her health insurance had run out.
Of course, the minute that I'm not covered is when I really need it. You can be singing along, great.
So she sought care at All of You UCLA Medical Center, a public hospital in California's San Fernando Valley, and she dreaded the prospect.
I think it's so easy to feel like a number at any hospital.
But Capasso discovered an extraordinary service.
Nice to see you again.
With money from the AVON Foundation, several public hospitals across the U.S. have what are called navigators for breast cancer patients.
And this is just to help you.
Lori Viveros heads the program at this hospital.
I think it's so important to have a continuity of care, particularly in public hospitals. So we're able to reach the patient.
Viveros and her staff make sure every woman understands her options, knows when her appointments are set,
This is Neri calling you.
and is able to process all the information she gets from the medical staff. Viveros is fluent in Spanish, especially important at this hospital, where most of the patients are Hispanic.
When Lori or one of her staff are with them, the patients feel much more comfortable in asking questions and being a part of their treatment decisions.
Because of the economy, public hospitals like this one have had about a 20% increase in cancer patients in the past year, without any increase in staff or other facilities to deal with them.
I'm gonna leave that with you.
A bright spot has been the privately financed navigators.
I think we're set.
Francesca Capasso, who is fine now, thinks all cancer patients should have one.
Why can't everybody have an advocate on their side who is an expert in the field of their disease?
Esa es la más larga que tenemos.
The answer is money. Most navigators are paid by private donations, most often for breast cancer.
Yeah, I really like this one.
Robert Bazell, NBC News, Sylmar, California.